Hi guys! Before we start learning with this new topic, subscribe po muna kayo and don't forget to click that bell button para laging updated sa mga latest kaganapan dito sa ating channel. Comment na rin kayo if you have requests or questions. Happy learning! So number 51. So what is the advantage of conventional radiography to CT scan? So mas maganda yung spatial resolution niya ng conventional radiography. So 52, what type of magnet used in MRI does not require large amount of electrical supply and a cooling system? So of course it is permanent, but it is always on. 53, the following are advantages of MRI over CT scan except. So that is ability to image calcified structures. So 'di ba kasi pag bony structures, calcified structures, mas maganda yung CT. For soft tissue naman yung MRI. 54, which of the following provide the affinity to the special body tissue? So affinity yung keyword natin, it refers to ligands. I think lumabas na ito sa board exam. So it is a ligand is an ion or molecule that binds or affix or allows something to join that binds to a central metal atom to form coordination complex. So affinity ligand. So 55, it refers to the net result of the decay mode when there is a conversion of neutron into a proton with simultaneous emission of negatively charged particle. So that is beta minus. Okay, so there is a decay of negatively charged particle. 56. What is spectroscopy? So it is the study of energy distribution to a radiation field. 57. So it is a device to determine which portion of the detected spectrum is to be used for creating a nucmed image. So that is letter A. So it determines, it analyzes kung anong pulses lang yung gagamitin or tatanggapin niya para mag-generate ng nuclear medicine image. So it is the PHA or the pulse height analyzer. 58, what is the purpose of asking the patient for bone scan to urinate before imaging? So that is to visualize the sacrum. So lumabas na rin ito sa board exam before. So bakit pinapaihi yung patient before mag-perform ng bone scan? That is para hindi siya matabunan ng urine and ma-visualize na mabuti yung sacrum. 59, what type of radiopharma is used for thyroid scan if the patient is scanned 30 minutes after the introduction of the said radiopharma? So the correct answer is technetium-99 pertechnetate. Next, what is the decay mode of technetium-99M? So of course, since it produces gamma rays, so it is isomeric transition from its parent, which is molybdenum-99. 61, what do you call a hollow metal found in the cyclotron where subatomic particles are being accelerated? So that is the waveguide. So 62, which device is used to produce radioactive material by accelerating ions to high energies and projecting them toward stable materials. So we call that a nuclear particle accelerator. So it is a device to produce radioactive material. Ito, keyword nyo din, accelerator. 63. Device that under controlled conditions are used for supporting a self-sustained nuclear reaction. So, reaction is a nuclear reactor. 64. Which of the following term describe the end of the radionuclide procedure during which time the radioactivity is eliminated from the body. So it is wash out. So may elimination na ng radioactivity from the patient's body. 65, technetium-99 plus colloid is specified to what organ and nuclear imaging. So that is liver. So technetium-99 plus colloid. 66. So MAA plus technetium-99 for lungs. So that is macroaggregates albumin. 67. So for the DTPA for kidneys, DTPA is diethylene triamine pentaacetate or pentaacetic acid. 68. What is the route of administration of iodine 131 mg in treating thyroid malignancy? So that is through IV. 69. How many minutes do we start to scan after introduction of 100 megabecquerel technetium-99 per technetate for thyroid scanning? That is about 15 minutes later. Wala itong 30. Na-add na yan. 15 minutes. 70. For brain dementia such as Alzheimer's disease, seizure localization foci, and for cerebral vascular problems such as cerebral ischemia, trauma, and brain death, the IV injection of 800 megabecquerel blank examination is done 30 minutes later. So we are using the HMPOW, technetium-99 HMPOW. So 71, renal scan. For parenchymal anatomy and function evaluation uses DMSA. 72, the following are true statements about emphysema. So that is 1 and 2 only. So the appearance of the retrosternal space is radiolucent with dirty chest appearance, and the chest is barrel shaped. So these are the presentation of patients with emphysema. So 1 and 2 only. 73, a laborer fell from the third floor of the building where he is employed as a mason. Upon thorough neurological exam, he was found to have deficits in the cerebellum. The rad tech on duty knows that the function of the cerebellum is for coordination, coordinate voluntary movement, and maintains trunk stability and equilibrium. 74, which among the types of stroke does not belong to the group? So hemorrhagic stroke. 75, the common cause of hemorrhagic stroke is aneurysm. And 76, the RadTech receives a 5-year-old patient who has signs of rashes all over the body. Then the mother explains that the rash appeared first at the hairline and then continued to spread towards the legs. She also noted some spots on the inner cheek of her child. So the RadTech knows that this is a sign of measles. So, yung mga signs and symptoms na nakita sa baby, yung rashes niya, hindi naman siya baby, 5 years old na siya. So, nakita, nag-start sa hairline, and then nag-spread na siya later. So, it is a sign of measles. 77, patients diagnosed with SLE have the hallmark sign of butterfly rash on the face and fingers and toes. Then it turns white or blue when exposed to cold or during stressful periods, which is also known as the Sjogren's syndrome. So SLE stands for systemic lupus erythematosus, I think. So 78. The following are classic hand signs for patients suffering from rheumatoid arthritis, except. So 78 is letter D. So all of this, they are correct. They are the hand signs for patients suffering from RA or rheumatoid arthritis. 79, this is known as the flexion contracture of the PIP joints and extension of the deep joints. So this refers to the boutonniere deformity. So sa radpato yan. 80. This is known as hyperextension of the PIP joints, compensatory flexion of the deep joints. So that is swan neck deformity. 81. Disorder identified by its two most common symptoms, the keratoconjunctivitis sicca and xerostomia. So it refers to Sjogren's syndrome. 82, a group of rare diseases that involve the hardening and tightening of the skin and connective tissue. So that is, some keyword nyo, hardening. So scleroderma. So skin, derma. Pneumonia affecting the supporting structures of the lung like the pulmonary vessels, bronchi, and connective tissue are believed to be caused by viral pneumonia. So it affects the pulmonary vessels, bronchi, connective tissue. 84 refers to the opacity on chest X-ray associated with fluid filling of the air spaces. So that is alveolar opacity. So fluid filling of the air spaces in the lungs. So makikita siya sa chest X-ray. So that is alveolar opacity. 86. The following are radiographic signs seen on abnormal dilatation of the bronchial tree. So that is 3, 4, 5, 1. So 1, 3, 4, and 5. So thumb track sign, signet, ring sign, string of beads sign, and cluster of grapes sign. So that is for abnormal dilatation of the bronchial tree. 86, pleural effusion demonstrate the following on a radiograph except. So that is except absence of meniscus sign. So lahat sila, they present pleural effusion except the absence of meniscus sign. So the following, 87, the following are the radiographic features of a total or partially collapsed lungs except 3 only. So this one, elevation of ipsilateral hemidiaphragm, crowding of the ipsilateral ribs, and crowding of pulmonary vessels or air bronchograms. So they are all correct. So ito lang yung wrong. Shift of the mediastinum towards the side of non-atelectatic lung. 87, beriberi is a deficiency with what vitamin? So thiamine. 88, a deficiency in ascorbic acid will lead to what disease? Scurvy. So vitamin C. 89, congenital cardiac anomaly where there is persistent opening of the normal connection of the fetal circulation between the aorta and pulmonary arterial system is referred to as PDA or the patent ductus arteriosus. So it is a congenital anomaly. 90. You receive patient in the diagnostic imaging department, and as you read the patient's chart, you noted that the nurse listed his blood pressure on the upper arm at 150 by 110 and the reading of 90 over 60 on the lower leg. So you understand that the patient probably has a coarctation of the aorta. 91, the following are the radiographic signs seen on coarctation of the aorta except 2 and 3. So these are wrong. So pag may coarctation of the aorta, so it will present figure 3 sign and wrestler sign. So figure 3 sign, so makikita sa coarctation, katulad ng wrestler sign. Yung golden S sign can be seen on collapse upper lobe ng lungs. Yung egg on a string sign, so may cardiomediastinal silhouette seen in PGA or transposition of the great arteries. So kapag coarctation, ito yung kanyang pinaka-main na sign, na hallmark sign. 92. What are the signs and symptoms of Cushing syndrome? So Cushing syndrome, so it is a disorder that your body is making up too much, producing too much amount of cortisol. So kapag ganito yung case ng isang patient, so ano yung mga signs and symptoms niya? So that is 1, 3, and 4. So 1, 3, and 4. Yung bronze skin, so this is common naman sa patient with hemochromatosis. So this is where the body absorbs excess iron from food. So ito, production of too much cortisol or yung ating stress hormones. So kapag nai-stress tayo, so napoproduce ng cortisol. So it helps us to respond to stress. Yung bronze skin naman is symptom siya if the body is absorbing too much or excess amount of iron from the food. 93, the figure 3 sign is composed of which of the following? So kanina nabanggit natin ito. So this is common sa patient suffering from aortic coarctation. So these are the signs except letter A. So ito yung mali. So secondary to dilated intercostal collateral vessels. So hindi siya, mali siya. Ito yung tama. 1, 3, and 4. 94, a serious but rare heart defect present at birth in which the two main arteries leaving the heart are reversed. So this is what we call the transposition of the great vessels or your TGA. So yung two main arteries nagkabaligtad. 95. What are the abnormalities that make up the tetralogy of Fallot? So tetralogy of Fallot is a defect that affects the normal blood flow of the heart. So ang abnormalities niya include overriding aorta, VSD or the ventricular septal defect, and pulmonary valve stenosis. So 1, 2, and 3 only. 96. So the following signs are seen on babies with TET spells except. So when we say TET spells, so ito yung bigla-biglang nagkakaroon ng deep blue skin, blue nails, and blue lips yung isang baby pagkatapos niyang dumede or patapos niyang umiyak. So TET spells ang tawag doon. So TET spells are caused by rapid drop in the amount of oxygen sa blood. So except blue sclera. So hindi naman nagbo-blue yung sclera niya or yung white ng ating eyes. So blue lips lang, blue nails, and blue skin. 97, the second most common highly malignant primary bone tumor of childhood after osteosarcoma is A, the Ewing sarcoma. So, ang first is osteosarcoma. Common siya sa bone tumors ng bata and then followed by Ewing sarcoma. So, yung scleroderma, so it is a rare disease, yung hardening and tightening of the skin. And then yung Paget's disease naman, second most common type of bone disease after osteoporosis. So, ang osteopetrosis naman, so it is a weak bone, so making them fragile and more likely to break. Number 98, occurs when the lesion grows too fast and the periosteum does not have enough time to lay down a new layer and instead the fibers stretch out perpendicular to the bone. So it refers to the sunburst appearance. Tandaan nyo lang yung keyword dito. Ito siya. So, pag sinabi namang lamellated onion skin appearance, so para siyang onion skin na multi-layered. So, it demonstrates multiple concentric parallel layers. So, that is lamellated onion skin appearance. Yung Codman triangle naman is most common seen sa musculoskeletal plain films. And the zebra stripe appearance, so this appears naman during when the children are treated with uh, cyclical biphosphonate therapy. If the child is suffering from osteogenesis imperfecta and then he or she is treated with cyclical biphosphonate therapy, so meron siyang sign na nape-present, so that is what we call the zebra stripe appearance. So ito, yung sagot again is letter B, sunburst appearance. And last two numbers, chest radiographs may classically show with an upturned cardiac apex due to the right ventricular hypertrophy and concave pulmonary arterial segment. So this is what we call the boot-shaped heart. So yung sales sign naman, so it suggests a lower lobe collapse of the lungs. Yung golden S sign, so nabanggit ko kanina, ito yung makikita natin sa PA chest x-ray of the right upper lobe naman. Right upper lobe collapse. And then yung egg on a string, so it refers to the common siya sa transposition of the great arteries. So ito yung parang silhouette siya seen on the TGA where the heart appears globular due to abnormal convexity of the right atrial border. And last number, a patient with Addison's disease is the following signs and symptoms except. So Addison's disease is also called adrenal insufficiency. So this is an uncommon disorder that occurs when the body does not produce enough particular hormone coming from your adrenal gland. So yung signs and symptoms niya include signs and symptoms include salt craving and bronze skin. Okay? So the correct answer is, kasi except yung hinahanap, the correct answer is 3 and 4. So kapag may Addison's disease, so may salt craving, may bronze skin. So wala siyang hyperglycemia and increased weight. So usually ito, common siya sa Cushing syndrome. So that's it for our rationalization for the 100-item RadSci. Sana makatulong and sana may lumabas sa board exam sa mga kahit isang question lang yan. So it still matters. So for those who are taking the board exam next week, so hindi na pala next week, this weekend na pala. So good luck everyone. God bless. Hoping and praying that you will pass the board exam. And mag-upload pa ako. Pero siguro wala nang rationalization, yung may mga answers na lang para makatulong kahit paano mabasa ninyo. Okay? So just message me, just comment if you have questions. So I will try to answer that as soon as possible. Okay? So good luck everyone and God bless.